I will demonstrate how to insert an NG tube into my patient here. So first I would wash my hands, explain the procedure to my patient, check their ID band, check for the order and everything like that. Then gather my supplies. So I will need clean gloves, my suction canister and everything set up, tape, my NG tube, a towel or Chuck's pad, water soluble lubricant, and a irrigating syringe, a 60cc one. Also my stethoscope, a basin in case they get sick, and a safety pin for after to attach to the gown. So after I've explained my procedure and I have all my supplies, I want to make sure that my patient's sitting up since they are conscious and awake and alert. Oh, and I also need something, the patient a drink. So I would have the patient have a drink ready too. So then after I have all my supplies and I've explained the procedure, then I can get ready. So my patient is in an upright position, and then I will put the chucks on their lap like a bib and get the basin ready. His arms should be out. And then I'll wash my hands once more and put on gloves. Then I'll measure my NG tubing. So I'm pretending this isn't my NG tube. So I'll measure from the nose to the ear, and then the ear to the xiphoid process, and I would tape that off. So that's how far that I'm going to insert my tubing. So now that I have that done, I can lubricate the end of the tubing and begin. Well, first I would check the nostrils actually to make sure that there's no blockages or anything like that, and then at that point, then I can lubricate the area that I need to on my tubing. And I could also tape, if the tubing doesn't have lines that indicate like measurements, I can tape where I measured from the nose to ear and then here so that I know. So then once I'm ready, I'm going to ask my patient if it's okay if I begin, and I'm going to start inserting the tube aiming for the opposite ear. And once it's in, I'm going to ask them to take sips of water and make sure at this time I'm always assessing my patient, making sure that they're not turning blue and they're breathing, and if they begin to cough, it's probably in the wrong spot. So then once they're taking sips, I can continue to advance it until I get to my measured point. And then at this time, I will check placement. So it's very easily pulled out, so I'm just going to be careful while it's here, always asking that my patient is okay. And then at this time, I can take my 60cc syringe and aspirate some stomach contents. And once that I do that, I can know that if it's using my pH strips, I will know if it's in the right place. If the pH is 1 to 3, that means that it's in the stomach. Also, I can inject 30cc of air and listen to the patient with my stethoscope for a whooshing sound. And that means that the air is gone into the stomach. And then usually the third way to check would be a chest x-ray. Sometimes that's ordered to verify placement. So if my placement is correct, then I can tape this in place. So I'll get a piece of tape, a strip of tape, and cut a line down the middle, just about 3/4 of the way up. Then I can tape down the bridge of the nose, and I would have gloves on, obviously, this whole time. So I would tape down the ridge of the nose, and then I can wrap the little ends around the tubing so that it stays put, and then pin any of the excess down onto the gown, and just make sure the patient is aware that it can be pulled out very easily, so they need to be careful. And then at the end of this, I will connect my end of the tubing to my suction so that it's all hooked up and ready to go, and make that this time make sure that my patient's okay, continue to assess them, and always making sure that the air blue pigtail portion is open so that it's not blocked in any way or kinked. And that is it.